Today we are going to talk about ALS, amyotrophic lateral sclerosis, named by Jean Martin Charcot 1874, and it is also known as Lou Gehrig disease.
ALS, also known as amyotrophic lateral sclerosis, is a rare disorder. It was named ALS by Jean Martin Charcot in 1874. It is also known as Lou Gehrig's disease. Amyotrophic, in which A stands for no, myo means muscle, and trophic means nourishment. It's a progressive disease. It affects both men and women ages 55 to 75 years. And its cause is unknown in 90-95% of cases. In 5-10% are inherited, with familial cases caused by mutations in the C90rf72 gene or the production of the enzyme copper zinc superoxide dismutase 1. ALS is characterized by mixed upper and lower motor neuron signs and is progressive, resulting in weakness, atrophy, fasciculation, dysphagia, dysphasia, hyperreflexes, and spasticity. Muscle twitching, as if a worm is crawling under the skin, which becomes increasingly frequent. Sometimes slurred speech and swallowing problems are the early symptoms of the disease. Diagnosis is based on EMG findings, and the disease can be classified as possible, probable, or definite depending on the number of regions involved. See a doctor, neurologist, or neuromuscular doctor. ALS has three main clinical presentations: limb onset, bulbar onset, and respiratory onset. The bulbar onset has the worst prognosis, with dysarthria, dysphagia, siluria, and malnutrition, eventually leading to anarthria. 55% of patients have mild to moderate depression. For ALS scale, ALS-FRSR scale. Neurotoolskit.com. To rule out other disorders, MRI of the brain, cervical spine, and thoracic lumbar spine are recommended for bulbar and extremity symptoms. Other tests include a Lyme disease test, HIV test, and a heavy metal screen for lead and mercury. Laboratory tests should include complete blood count, comprehensive metabolic panel, calcium, magnesium, phosphorus, thyroid function tests, creatine kinase CPK, vitamin B12, rheumatoid factor, sedimentation rate, and anti-GM1 antibody. A 24-hour urine protein electrophoresis with immunofixation should also be performed to rule out multiple myeloma. Cerebrospinal fluid CSF cytology and increased neurofilament may also help diagnose the disease. Treatment options include riluzole, edaravone, and non-invasive ventilation, plus excellent clinical management. Visit NIH Clinical Research Trials www.clinicaltrial.gov.